I'm joined by Dr. Imane Moest, who is the Global Head of Chronic Remote Care for Roche. Imane, thank you so much for joining us today.
Thank you for the invitation.
So as healthcare moves towards more preventive approaches and away potentially from curative, how are Roche's remote monitoring solutions contributing towards this aspect of, 4P medicine?
Sure, so before I go into the detail, really the shift from reactive to proactive care is really no longer a choice, right? The pressure that this is imposing is massive, and so we really need to keep that in mind. And so at Roche, we are extending our portfolio towards remote monitoring, and this will actually support basically ensuring better disease progression, but then also prevention. I'll take the example of disease management as per your question, where in our continuous glucose monitoring business, we are actually providing algorithms that help patients to monitor their glycemia and the evolution of the glycemia. So for example, an AI-trained algorithm that gives a 2-hour projection, really being able to actually take charge and make some changes to your diet before actually you have some severe situations. Another one that's actually looking into preventing night hypoglycemia, for example, which does two things. Obviously, again, here prevents from having a severe situation, but then also removes the stress from patients. So really here, a complete solution that offers better prevention and more preventive care.
Sure, thank you. And this question of AI then, so how is AI impacting the delivery of 4P medicine sort of more broadly?
I mean, AI is everywhere, right? We hear it all the time. It's a very fast-moving capability, and so, the potential is massive. We see a lot of opportunity in improving patient care. We are able to then have earlier intervention, as I described now in the context of, for example, diabetes. But not only, we can also improve operational efficiencies, with AI supporting automation and removing then the burden, the administrative burden, and also the burden on hospital and lab staff. And then, of course, we can also see how we can achieve savings to the healthcare system because we're reducing unnecessary intervention, really. So the opportunities are multiple, just to cite a few. And then, obviously, there are also challenges, like with challenges integrating all of the diverse data sources. This is really not something that everyone can do and everyone is positioned to do so. Being able to use accurate, unbiased algorithms, also quite important, clinically validated, etc. And then personally, what I find also being the most challenging part, but then also the one that I have the most passion for, is the adoption. Like, we also need to work with the entire ecosystem to make sure that we're also co-creating some of these technologies together so that we drive also some of this adoption. But adoption is a challenge, right, that we cannot oversee. Yeah, so really to close on this, we have full commitment at Roche, and these are the challenges that we're really looking to tackle to support the healthcare system moving forward. Yeah.
Well, thank you, Imane. That's really fascinating, really interesting. The work that Roche is doing is truly fantastic in this field. So thank you so much for your time today, and I look forward to seeing you around the conference.
Yeah, likewise.